Connected Health and ICP Triage Manager. Connected Health is the consistent and accurate remote monitoring of patients' vital signs and well-being data, monitoring patients with long-term conditions within their own homes. The key features of Connected Health are priority of 5 diseases: diabetes, congestive heart failure, coronary artery diseases, chronic obstructive pulmonary disease, and hypertension. A proactive, coordinated approach to chronic disease management. Proactive identification, assessment, enrolment, and monitoring. Strong support for multidisciplinary care, care planning, and care coordination. Recognition of general practitioners as main medical care providers. Strong support for patient self-management. ICP Triage Manager is a web-based application which enables clinicians to interpret readings taken by patients in their own home, a care setting, or any other location using medical certified measuring devices to assess their state of health. ICP Triage Manager is intended for system users who fall into one or more of the following categories: healthcare professionals who view and/or triage patient information, for those handling patient data, diseases from which patients may suffer, and which healthcare professionals are involved to fulfill their role in the delivery of support. Implemented processes for handling specific patients via the system. Devices used by patients and their clinical accuracy. For those handling technical issues, knowledge of the technical information and problems related to the equipment used by the patients, the usage of the equipment, the processes implemented for triaging technical information and handling problems, administration of the equipment used by the patients. To log in, click the ICP Triage Manager link provided by the system administrator. Enter the unique username and temporary password supplied by your system administrator. Once logged in, reset the password via the password reset page. This is the landing page when you log in for the first time in ICP Triage Manager. Please note, if two-factor authentication is enabled, you will be required to enter the unique identifier automatically sent via email or SMS before login. ICP Triage Manager includes various functions and features such as enrolling new patients, Triage Dashboard, viewing current reading and its severity, acknowledging readings, sending messages to patients, managing treatment teams, adding important notes within a patient's record, viewing reading history, pulling patient reports, adding providers, and providing their access levels. The default opening screen of ICP Triage Manager is the Triage Dashboard, from which patient readings and interview responses can be reviewed. System users can acknowledge readings, make notes on the patient, and create tasks for treatment teams and providers to complete. All of the readings in Triage Dashboard have severity legends associated to them to indicate the risk level of the readings. To add a new patient to ICP Triage Manager, on the Patients tab, select New Enrollment. There are 6 tabs, each of which manages essential patient information. Patient information, the basic details of the new patient. Medical information, details of the medical issues the patient has. Care team, the care team to which the patient is linked. Monitoring plan, the activities the patient will undertake, such as taking readings and completing interviews. Devices, the peripherals which will be provided to the patient. Complete, a new patient cannot be added to the service until all tabs have been completed with all mandatory information entered and Enroll Patient has been clicked. Patient menu is used to view all of the triaged information for the patient. The Current Reading tab within the patient menu lists the recent and unacknowledged vital readings of the received from the patient end. The readings are represented along with a severity legend to notify the provider with the risk level associated to that reading. The clinician can acknowledge an individual patient's reading, or multiple readings can be acknowledged by selecting the tick box with the Current Reading tab / Reading History tab / Triage Dashboard. Messages can be sent to a patient or another provider using ICP. Messages sent from or to a patient will be visible to all ICP users that have access to the patient. To compose messages, click the Compose button. To send a message to the patient, choose from the patient drop-down list, fill in the message details and press send. Providers can send messages to each other regarding a patient they both have access to by first choosing the patient and then clicking the provider button. This will then allow the provider to choose another of the patient's providers to receive the message. Notes can be added to a patient record in ICP Triage Manager. The notes can be made important by marking the note as Important Note. This helps the provider to keep track of any important messages or notes for the patient. Reports are available to authorized system users within ICP Triage Manager on the Reports tab. Various patient reports, such as patient compliance, patient summaries, patient list, program trends, profile, and data extremes can be generated from ICP Triage Manager. All administrative activities, such as adding a provider into ICP and providing the right access levels for the provider, can be performed within the Administration tab. If you need any assistance using ICP Triage Manager, please contact our friendly team at au.servicedesk@tunstall.com.